From UNDP Zimbabwe, I am Joyous Begisen. Ahead of the Global Fund's 8th Replenishment Summit, this is our Pulse Check with Resident Representative Dr. Ayodele Odusola. Today, we continue exploring the 5 principles guiding the Global Fund's 8th replenishment. In this episode, we focus on the first 3: solidarity, sustainability, and innovation. Dr. Ayo, when we speak about solidarity, what does that look like in practice here in Zimbabwe?
Solidarity has always been at the heart of our work. For more than a decade, UNDP has stood shoulder to shoulder with the Government of Zimbabwe and the Global Fund in the fight against HIV, tuberculosis, and malaria. As interim principal recipient for the Global Fund HIV grant, we manage resources on behalf of our partners, ensuring that every dollar translates into access, equity, and impact. Together with the Ministry of Health and Childcare, the National AIDS Council, the Family AIDS Caring Trust, the Biomedical Research and Training Institute, the Health Service Commission, the Medicine Control Authority of Zimbabwe, the National Pharmaceutical Company, and the World Food Programme. We've strengthened HIV prevention, treatment, and care services in every part of the country. Zimbabwe has achieved a significant milestone in its fight against HIV and AIDS, surpassing the UNAIDS 95-95-95 target among the adult population. But challenges remain for the children.
So solidarity really means everyone playing their part, from national institutions to communities.
Exactly. It's that shared purpose that has allowed Zimbabwe to maintain strong progress. Over 2 million HIV tests in the past year, surpassing national targets, and 95% of those testing positive linked to treatment and care. Those results speak to the power of partnership, working together for one goal: ending AIDS as a public health threat by 2030.
Let's move to sustainability. UNDP often says it's not about implementing grants, but helping countries build systems that last. How has that unfolded here in Zimbabwe?
Sustainability is about national ownership. Our approach ensures that while UNDP manages the HIV grants, the Ministry of Health and Childcare leads the response, supported by a network of sub-recipients. Together, we are building capacity so that Zimbabwe's institutions can fully own and manage these programs in the future.
And what kind of impact has that approach had so far?
It's been transformative. For example, through building resilient and sustainable systems for health, over 27,000 health workers have been retained since 2009, keeping facilities staffed and services running in even the most remote areas through village health workers. We've also supported digital health systems, training in procurement and supply chain management, and construction of 4 world-class warehouses and hundreds of pharmacy stores and laboratories across the country, all aligned with the ministry's leadership and vision.
That does sound like real progress towards a health system that can sustain its own gains.
Precisely. True sustainability means systems that outlast any grant cycle, national ownership and capacity anchored in strong institutions, proactive involvement of beneficiaries in maintaining and securing facilities is key.
Let's talk about innovation, something you're very passionate about. How is UNDP bringing innovation into the health sector?
Innovation is what keeps our response relevant. Through the Solar for Health initiative, we've installed solar systems in over 1,000 health facilities across Zimbabwe, cumulatively providing 11 megawatts of clean energy and reducing carbon emissions by more than 16,000 tons each year. That means clinic can deliver babies safely at night, vaccines stay cold, and lab tests run on reliable power. We are also leveraging digital systems, real-time data tracking, and dashboard that helps health facilities monitor medicine stocks and prevent shortages. The integrated sample transportation represents a breakthrough in Zimbabwe's laboratory services, consolidating multiple transportation networks into a single efficient system serving all 63 districts and about 2,000 health facilities. Zimbabwe's digital health innovations, including district health information system, laboratory information management system, electronic health records, have been comprehensive, focusing on modernizing data collection, management, and analysis system to support evidence-based decision-making and improved healthcare delivery. The installation of incinerators at Impilo and Sally Mugabe Central Hospitals has enhanced waste management capacity to safely dispose of infectious and hazardous healthcare waste. These innovations are making the health system more efficient, climate smart, and accountable.
So, what I'm hearing is innovation is not just about technology, it's about rethinking how we can deliver healthcare altogether.
Exactly. It's about doing development differently, faster, greener, and more resilient. As we look toward the Global Fund's eighth replenishment, it becomes important that we protect the progress already made. Continued investment allows integrated HIV, TB, and malaria services to work together in real practical ways. For example, a solar-powered clinic can keep HIV medicine stable, run TB diagnosis reliably, and ensure malaria test kits are ready when needed. And with UNDP's strong fiduciary oversight, partners and communities can trust that resources are well managed, monitored, and reaching the people they are meant to serve.
Solidarity, sustainability, and innovation. Three principles that continue to define Zimbabwe's journey with the Global Fund and the trust that underpins UNDP's partnership with the Government of Zimbabwe.
Indeed, our partnership is built on trust, results, and a shared commitment to a healthier future for all Zimbabweans. Together with our partners, we will stop at nothing to end AIDS as a public health threat by 2030.
Thank you, Dr. Ayo, and thank you, our listener. Join us next time on the Pulse Check as we talk about equity and reform and how quiet changes are bringing a stronger, fairer health system for everyone.